My first question to you is, have you ever had any surgery from the time you're born to today? If your answer is yes, then please stay with me to actually learn that that might be the reason why you ended up with chronic lower back pain, neck tension, hip flexor tightness, and many other joint and muscle or tendon problems. Even if you tried, adjustments, exercise program, massage, acupuncture, and still are in pain, which means those are very powerful treatments, and if they did not solve your problem, that tells something, that the cause hasn't been treated. I want to explain first a personal experience. When I was 5 years old, I had a hernia surgery on my left side. As growing up, young kid, I was a competitor swimmer and a cyclist, and I could never understand why I'm super built on my extremities, but I always had a little bit bigger belly. About 7 years ago, I took training in muscle testing, and that's where I learned that scars, surgical scars, can actually affect how your muscles function. And the way that they were telling us, training us to treat the scars, it was, touch, massage the scar, so hopefully your system can reconnect to the site where the skin was cut. Because my specialty is shockwave therapy, and I've done over 50,000 shockwave treatments in my personal experience, while I was in training, I thought, hey, I can probably reset this using shockwave therapy. Came home, tested first on myself. Couple weeks later, people said to me, oh, you've lost weight. And I said, no, I still weigh the same, but my core muscles started to engage. And it wasn't something that I had to keep treating it. It only required 2 or 3 sessions initially, and that was it. And since that time, I'm talking from my personal experience, every single client that walks in my room that has a chronic pain for minimum 3 months and have tried everything else unsuccessfully, they have some kind of surgery in their body. And let me explain you why that happens. So imagine our skin, it is the biggest organ. The skin supplies our brain, our nervous system with information. So for you to move, for you to do things, for you to grab a bottle, you first need to feel thirsty. You want to drink water. You see the bottle. Your system does a calculation and it tells the muscles, hey, please grab that water of bottle and bring it to me so I can drink it. So that explains that muscles are only a delivering mechanism. They don't have their own brain. They don't make their own decision. So first they need the information. When you have a surgery, and it doesn't matter the size, it doesn't matter if it was cut like this or vertically or laparoscopic surgery, they have cut the skin, they have cut the fascia. So fascia, it's another almost like a skin layer for the muscles. That's where all the nerve endings are. So let's take an example of a C-section or appendectomy or any abdominal surgery, tummy tuck, breast augmentation, gallbladder surgery, open heart, you name it. When that surgery happens, there's going to be nerve ending damage that happens to that region. After the surgery, you're going to have your personal needs to get up and walk around. What's going to happen? Your nervous system is not going to actually find proper information, stimulation coming from that side. Therefore, it cannot use your core muscles. It cannot use the muscles of that region. And what happens? because we're always in surviving mode. Our nervous system, it's always trying to keep us alive. It finds now muscles that do similar motion as your core, flex your body, and start using them instead. So one of them is your hip flexors and neck flexors here. So what that does automatically, these muscles become your core muscles in terms of the function. Now, because there's no core support, your lower back muscles take over right away. So then these muscles go in overworking mode. So they tighten up, and because the cause is not treated, this is not resetted, you're young, you can compensate. Even if you're young, you get a second injury, third injury, something else happens, you sprained an ankle, so now you cause multiple compensations in your body. So now your body has to actually compensate for a lot of things, and it can't. So it starts giving you pain. So pain is just a signal that your nervous system is requesting a change. It's telling you, hey, please do something. Change whatever you're doing because I cannot handle, I cannot function like this. Another example, you wake up in the morning, let's say you have 10 liters of energy. Your body is going to use 5 liters for muscle skeletal system, so you can walk, move around, and 5 liters for organs, so you can stay alive. If your muscles and bones are not working efficiently, they're going to require more energy. And therefore, towards the end of the day, you're going to start feeling more tired, you're going to need more coffee, you're going to need more stimulants. And vice versa. If you get sick, you got a virus attack or whatever it is, or a cold, your body needs more energy to fight inside. It takes that from the muscles, and it's much harder for you to work out, to walk, to do things. Are you still with me? Do you understand like how everything works? Because in the end of the day, human body, it's one single structure. We are not pieces. Because you sprained your ankle, you had surgery a long time ago, that still is in your body, that still affects you. So what we do, and what I have created to fix this problem, is we use shockwave. So we go and treat your scars, so we can send signals, stimulation back from the scar to your nervous system. And then the nervous system picks that up instantly because its own natural pattern, way of communicating with that side. Instead of talking too much, I'm going to actually show you a before and after treatment that I did on a client that she had the surgery when she was 18. Now she is on her 70s, and she always had chronic lower back pain. And you can see the difference before and after. Okay? Stay with me here till I pull it. And then we're going to go there. Here it is. Okay, so stop me. This is before treatment.
On my back.
Okay.
It's like, well, where do you think?
Yeah, I know, but thank you. So you notice there was no muscle strength. There was no core engagement. And when the core is supposed to actually engage, she was feeling it on her back. So this is right after treatment, which took about 5 minutes. Here,
Okay.
on the right.
Hold your legs there. Now stop me.
You've got to be kidding. You really have to be kidding.
That's it. Where do you feel now the pressure?
I'm not sure, but I don't feel it in the back.
Yeah.
It's like my legs have become strong.
And look at your feeling now on the core. Stop me. And this was since you were 18, correct?
So this is not a voodoo. This is based on the science, because that's the speed of your nervous system. That's how quick your nervous system communicates. And if there's proper communication, then there's going to be proper muscle engagement. Then there's going to be proper functioning of your muscle skeletal system. Okay? So this is what happens. This is what we do daily at Unpain Clinic. So our rule is, if you come in, it doesn't matter your complaint, whether you have a plantar fascia or you have a shoulder, you have a scar, we go and treat the scar. And from my experience, what I've seen, every single client that I've treated for scars, we only had to do one treatment on the scar to reset the communication. But then scars affect you another way, because wherever the fascia is cut, that's where the pulling is going to happen when it starts healing. So it starts actually pulling towards the cut. So all the fascia restriction, let's say you had appendectomy, it actually starts pulling more in the right hip. And then you wonder why my hip joint wore out. You get an x-ray, you're 60, 70. Why everywhere else I feel great, but I have this right hip joint worn out for no reason? There is always a reason. Injury and pain doesn't happen for no reason. Especially if your pain, it was a gradual build-up. That tells you that is related to chronic compensation. But let's say you fell down, you caused a physical injury, and you still have a surgery in your body, now you have 2 injuries. I cannot give you exact number on how many people we have treated for scars specifically, but that's how we have been functioning. I just know that it's been over 7 years, and we function pretty much based on word of mouth. We are the only place in the world. I have created this protocol to reset muscle function using shockwave to treat the scars. So if you have a muscle dysfunction due to the scar, I have created the solution to correct that. So if this still doesn't make any sense, you can actually get in touch with us. We'll schedule a telehealth session with you, and we can answer your question. Otherwise, the only thing left is wherever there's Unpain Clinic or somebody certified or trained by us, you can go and get this treatment done. Honestly, it might change your life. Thank you for your time.